Yeah, we all know very well that triptans are 5-HT1B and 1D receptor agonists, which are currently the standard of care of for the acute migraine, because many countries have not yet ditans and gepants. So this is our standard also in Slovenia and my country. However, the response to these existing triptans was not satisfactory, and only about 30% of patients were pain-free at 2 hours after taking the triptans. So additionally, the triptans discontinuation is very high. About 55 to 80% patients stop the treatment. So triptan also exert one HT1B mediation vasoconstriction effects and are therefore contraindicated for instance, hypertension, stroke, cardiovascular diseases, and so on. So the development of serotoninergic agonists without vasoconstriction properties, that means to 5-HT1F receptors, as Lasmiditan belongs to a new class of these receptors agonists, and are very promising because they demonstrated without vasoconstrictive effect. So, for instance, I think that one of those were Lasmiditan was already approved by FDA, and it is used now in the States, but not yet. I think not yet in Europe. Many countries in Europe. Then two big studies also showed the really big effect of those drugs, as Samurai and SPARTAN study, and they showed a big efficacy. And what is more important, very low rate of side effect. That means Lasmiditan had approximately the same rate of side effect as placebo. So this is very promising. And the next group of drugs for the acute treatment of migraine is CGRP receptor antagonist. So we have now for the preventative treatment CGRP antagonists. That means those drugs block the CGRP, which is a very important molecule for the migraine. Now we have new drugs, these gepants, which block the CGRP for acute treatment of migraine. That means that we will use those drugs against instead of triptans in the future. So they have no vasoconstrictive effect, very, very low rate of side effects, and it's also very, very promising for our patients and for us clinicians, who we are also very happy for the patient to stop the suffer of migraine. A lot of different molecules are involved in pathophysiology of migraine. For instance, one is 5-HT1D receptor, which was failed in the studies, but there are a lot of small molecules more which we can test, and of course there are still future for the migraine patients for the new treatments.